My name is Chad Black. Let's take a moment to think about what would happen if you were sitting in class and suddenly one of your classmates fell out of their chair. As you rush to their assistance, you notice they are no longer breathing and you cannot detect a heartbeat. And they're experiencing what we call sudden cardiac arrest. Due to the thick walls within the classroom, your cell phone won't work and get a signal. Therefore, you have to go down the hallway in order to obtain a signal and call 911 for help. This could take 2, maybe 3 minutes. Time that could lead to brain damage, or even worse for a person suffering sudden cardiac arrest, death. This situation is hypothetical, yet it does happen. It is a situation where better outcomes can occur. As a healthcare provider, today I'm going to explain to you the importance of automated external defibrillators, or AEDs, and what we can do to improve the statistics for sudden cardiac arrest. Sudden cardiac arrest is a major health concern. It's the leading cause of people's death at age 40 and over. 325,000 people die annually from sudden cardiac arrest. That's 9 out of 10 people who suffer sudden cardiac arrest die. Only 2% of these victims currently are treated with an AED, or automated external defibrillator. A 2000 study by the Journal of Respiratory Care Practitioners showed the chances of cardiac survival from sudden cardiac arrest can increase to 74% within 3 minutes of SCA occurring with the use of an automated external defibrillator. However, for every minute that passes without the use of an AED, that person's chance of survival decreases 7 to 10%. Early activation of EMS, emergency medical services, CPR, defibrillation with a device such as an AED, and rapid transition to advanced cardiac life support is the best management for persons suffering sudden cardiac arrest. Unfortunately, many facilities and businesses do not have an emergency plan or an AED readily accessible for people to utilize in the event of sudden cardiac arrest. In order for you to understand the importance of an AED when sudden cardiac arrest arises, you need to better understand what sudden cardiac arrest is. It is triggered by electrical malfunction of the heart, which is referred to as an arrhythmia, where instead of pumping blood how the heart normally does, the heart is just sitting there quivering. Therefore, it's not pumping the blood that our bodies need to sustain life. Of the two arrhythmias present, the most predominant one that people have occur in sudden cardiac arrest is ventricular fibrillation. Again, the heart quivering. The other most common rhythm outside of VFib or ventricular fibrillation is ventricular tachycardia. The only definitive treatment for sudden cardiac arrest when someone is experiencing VFib or VTAC is an electrical shock with a device such as an AED. Although there are ways to buy time till one can come. CPR and the chest compressions of manually compressing the chest and pumping that blood through the heart will buy time till an AED is available. You're circulating that blood. You're buying time. Now, let's pause again and let's look at that hypothetical situation we talked about. Let's say 911 has been called and CPR started, but you don't have access to an AED. Now our classmates' chances have dropped from that 74% to 25% or less. What can we do to change this? In order to change this from happening, we have to establish a community program similar to what Seattle, Washington did. In 1983, Seattle implemented the first ever program where 911 dispatchers provide CPR instruction by phone. In addition to that, they implemented a community CPR program for businesses, for schools, for institutions, and other community locations. Then they placed AEDs strategically in locations that enabled citizens, thousands of citizens in that community, to have readily access to those devices along with the CPR training. This was a collaborative effort by EMS, hospitals, 911 dispatchers, cardiology specialists, and the community. Now, compared to the rest of the nation, where remember the 2% that only have AEDs come to them and less than 10% people survive cardiac arrest in our nation today, Seattle, Washington now has a 60% or greater survival rate for sudden cardiac arrest as compared to the nation and other communities. While that story is hypothetical, it is actually real. It happened to a colleague's son of mine, a 21-year-old sitting in class in college 3 years ago, fell out of his chair, sudden cardiac arrest, and no AED available and no training. Unfortunately, at that young age of 21, he died. With proper training and equipment, we can reduce this from happening, and we can take those staggering statistics associated with it and decrease them. Sudden cardiac arrest is real, it happens daily, and it does not discriminate based on age. Many people have congenital heart defects never detected until sudden cardiac arrest strikes. I had that same happen to a family member who had never been diagnosed. Sudden cardiac arrest struck as he was walking around his pool, and he fell in and subsequently drowned. So it can happen to us. Thank you for your time.